So today we're going to introduce you to a new diagnosis, and it's called Bogus diagnosis disorder. We have the code right here. The main symptom is the urge to make up and invent a mental illness. And I'm specifically talking about the authors of the Diagnostic and Statistical Manual for Mental Disorders, the DSM-5. And you may not know this, but they actually vote on certain diseases, okay? There's no blood test. It's just all subjective. And sometimes you'll read this in the newspaper. There's this huge epidemic of mental health problems, right? Spreading all over the country. No, there's an epidemic of prescription drugs. 1 out of 6 Americans take psychiatric drugs. And the big question is it working? Are people getting healthier with their mental health? Actually, no, things are getting worse. We're getting more substance abuse. We're getting higher rates of suicide. But I want to share with you some very interesting scientific diagnoses that are in this book. The first one is called borderline personality disorder, okay? This is a condition where you're feeling more emotion more intensely for a longer period of time. Like, I don't know if you ever had a chronic feeling of boredom. I mean, I think that's pretty much normal for everyone to experience certain times in their life, and that's not a mental illness. But they say that we don't know the cause yet, but we think it's genetic, there's some brain dysfunction, or it's a problem with the environment. But until we do research and really find the cause, take an antidepressant. All right, next one, separation anxiety disorder. This occurs when you have a relationship or a marriage breakup, okay? I mean, you just need to get over it faster, or else you're gonna end up with this disorder. And when you read down the list in this book, it has a section on infants. And they stated that infants show stranger anxiety by crying when someone unfamiliar approaches. I think that's a normal response to a stranger, isn't it? I mean, that's the only way a child can communicate is through crying. And apparently this condition starts when you're 7 months old. I mean, I'd like to know how they determine that. What tests have they used to scientifically prove that? So you can take an antidepressant for that one. And then we have caffeine withdrawal disorder. First of all, this is not a mental disorder. This is a physical, chemical imbalance, okay? All right, here's one, premenstrual dysphoric disorder. So when you go through your menstrual cycle, you have a feeling of hopelessness or you have bloating in your lower abdomen, okay? This is hormonal. This is not a mental disorder, and it's treated with an antidepressant. It gets more hilarious. Check this out. Minor neurocognitive disorder. This is a situation as you get older, you have a decline in cognitive function that's beyond your normal age. This is a physical problem. Okay, this is probably the beginning of Alzheimer's because it starts 25 years before you even have symptoms. So this is a physical condition, and they're going to treat it with an antidepressant. All right, next one is my favorite, intermittent explosive disorder. No, you don't explode, but you have a temper tantrum or you start arguing, verbal arguments. And if you do that for 2 times a week for 3 months, you're going to get a diagnosis and you're going to get a treatment. And then we have somatic symptom disorder. This is extreme focus on a physical symptom, mainly pain or fatigue. I think I had this disorder when I was in my 20s because I was in pain and I was always tired and I was constantly focused on it. This occurs when you have excessive thoughts on your symptoms. So what you really should be doing is kind of ignoring them and not looking like you're in pain or you're tired. Now you may be thinking I'm making this up, but the diagnostic manual is this thick. It's filled with things like this, and that leads to a lot of over-medicated people and a lot of people that have been excessively over-diagnosed, if that's even a word. So here we have a situation of somewhat of a normal behavior that's labeled as an abnormal behavior that's treated with a medication that has side effects, okay? All of the psych drugs carry what's called a black box warning, okay? Why do they have this? Because they have severe side effects that can create way worse symptoms than the symptoms that you're trying to treat. Nausea, insomnia, impotence, weight gain, ejaculation disorder, abnormal bleeding, seizures, visual problems, increased risk of suicide. Are you kidding? Birth defects, heart condition. The FDA stated that they don't recommend Celexa if you have low blood sugar or low magnesium. Who doesn't have low magnesium? And one of the last symptoms, if you scroll down all the side effects, is sudden death. I guess people aren't paying attention to actually really hear what they're saying. But I'm sorry, if a medication causes sudden death, I don't think I'm going to take it. So anyway, in summary, there's a lot you can do for someone's mood, for someone's cognitive state, just with diet. That is something that is completely and utterly ignored. Healthy keto, intermittent fasting, B vitamins, specifically vitamin B1, vitamin D, are essential. Anyway, put your comments below and tell me what your thoughts are on this topic. So if you want more knowledge on how to create a healthy body, subscribe now and get daily notifications.